Hello, I'm John Harris, and I'm a patient of Dr. Morris. I suffer from spinal stenosis, and it started about a year and a half ago where I really started to notice it. And I went for about a year or even longer where it got progressively worse. The things I love to do, like playing golf, became difficult and then impossible. Playing tennis was difficult and then impossible. Running was impossible, and it got worse and worse to the point where it was difficult to walk. It was extremely painful for me to drive, and I have a job that requires I drive quite a bit, so that was very, very difficult. Well, my pain certainly got to the point where I'd say it was in the 8-9 range, if not a 10. I hit 10 on a few occasions. I would say on average, it never, when the pain really progressed, it never went below 6 or 7. So it was very difficult to sleep, drive, walk, just about anything. The pain was started up in this area here, my right buttocks, and went down mainly the back of my right leg to about the back of the knee. And then it started again in my right foot. So my right foot would get fuzzy and would be uncomfortable, and generally got to the point where generally during the day at work I'd have to take my right shoe off, and it sort of felt like it was asleep, fuzzy, but also a little bit painful, irritated. So I went to my family doctor initially, who recommended I go to an orthopedic doctor, and I did that, and he put me through what I think now is very conventional treatment prior to requiring any surgery. He gave me steroids tablets at first, which didn't help at all. Then I had steroid injections in the immediate area where I had the most pain. I had 3 of those over a 3-4 month period. They maybe helped relieve the pain for a couple of days, but that was it. And then the pain just progressively got worse and worse. The orthopedic doctor recommended that I get a spinal epidural. I was very excited that maybe that would finally give me relief, but it did not. So at that point I was getting very discouraged, and this took place over about a year, and my orthopedic doctor finally said, "John, we've tried everything we can, so at this point I'm recommending that you talk to a surgeon, and surgery may be the next thing." It can really be 3 results. It can either help, it can remain the same, or it also can make it worse. So I wasn't too happy about it, but the pain was so severe that I, at that point, was ready for just about anything, including surgery. About that time, I was very fortunate to discover Dr. Morris on the website, and his website spoke to me. The language he used let me know that he had had many patients in the past that had been through a very similar history that I had. At this point, the pain, which was primarily down my right leg and in my right glute, is essentially gone. I'm back playing tennis. I'm back golfing. I can run. I can walk. Driving gives me no pain at all. And it's a very common phrase to use, I think, with Dr. Morris, but I mean, I feel like I have my life back, and I thought that it's a miracle. I didn't think that was something that could happen after living with this for well over a year in pain that was intense 24 hours a day.